about boosters, especially, we're in August now, looking to the fall, looking to the return of school, but also the timing on these reformulated shots. You have one from Pfizer and from Moderna, and you see the FDA deciding now to wait a little bit for people under the age of 50 until these new versions come out.
Yeah, this is certainly a very challenging time for public health officials. There is a large portion of the population that right now is eligible for vaccination. And I think as we'll discuss moving forward, we're still grossly under-vaccinated in terms of boosters. But yes, for those under 50 who've been eagerly waiting their second vaccine, the FDA has decided to put this off in the hopes that they can deliver the new vaccines in the fall, projected to be sometime in mid to late September, originally in October and November, for both the Pfizer and Moderna vaccines that reportedly have significant improvement in their ability to combat against the BA Omicron 5 variant. Now, the real question is, if you're at risk, should you wait and get that booster, which is more appropriate for the current wave? And I think this is an important conversation for folks to have with their primary care docs. If you're an otherwise healthy person, it is likely okay to wait.
And I guess the other question really is, will people get it? You take a look at some of the numbers and, how people feel about getting additional shots after additional shots. And when you take a look at it, nearly half of people that are eligible just for that first booster, less than half went and got it.
Yeah, this has certainly been a challenge for those of us in the vaccine community. I think there's significant fatigue against the pandemic in general, and certainly some fatigue getting yet again another COVID vaccine. That being said, we are facing an increase in number in deaths and mostly high-risk elderly folks. We're seeing an increase in the number of diagnoses, and our hospitalization numbers have started to climb, though our ICU numbers remain relatively low and relatively constant. That being said, as we go back to school, we start moving inside again in the colder weather, we do anticipate a significant surge in the fall. Looking back, there's been a surge in interest in vaccination once a surge of diagnosis has begun. But at that point, you're a little bit behind the ball. So right now, I think it's important for people to choose if they're going to get the current booster, if they're eligible, or if they are young and healthy and otherwise willing to wait for the BA5 specific variants expected in September.